The hip kit includes a 26-inch reacher, a molded sock aid, a dressing stick, a long-handled round sponge, a metal or plastic shoehorn, and black no-tie shoelaces. Additional items could be a 36-inch reacher, a combination dressing stick, and a toilet paper aid.
Hi.
Hi.
I'll be your PT today. Oh, Victoria, correct?
Yes.
Was that? So today I hear you had a hip replacement, correct?
Yes.
Alright, do you know if it was from the front or the back?
The back.
Back? So that means you don't have any type of precautions that we need to worry about.
For this patient, there are no hip precautions we need to worry about. But for a patient who has had this kind of total replacement surgery, you may need to warn them of some precautions, including no bending the hip past 90 degrees, no internal rotation, and no crossing of the legs. This could lead to dislocation of the hip replacement. Next, you'll want to explain to your patient what you're about to show them and teach them, and if it's okay with them. Today, I will be showing the patient what is in a hip kit and how to use those items. The first item are elastic shoelaces. These replace your regular shoelaces and allow you to just slip your shoes right on and off without having to bend and tie your shoes. The next item is the dressing stick. This is a thin, lightweight rod that has hooks on each end. It helps assist the patient to get dressed without bending or reaching for clothes. The hooks also allow for patients to reach things that may be on the floor, and the smaller hook may also help with zippers. Another item is the molded sock aid. This is designed to help a patient put on their socks without bending over and reaching for their feet. The next item is the long-handled round sponge. This allows a patient who is showering to reach their feet, back, or other body parts without overextending or bending. Next is the reacher, which comes in two lengths of 26 inches and 36 inches. This is an assistive device that allows a patient to reach or pick up objects that would otherwise be difficult to grasp without bending or extending the body. Next is the shoehorn, which can be metal or plastic and comes in varying lengths. The smooth curved design helps the patient in donning their shoes without reaching or bending. Next is the combination dressing stick. This is a combination of a dressing stick and a shoehorn. It also encourages dressing independence for patients who have trouble bending and reaching. Lastly is the toilet paper aid. This is an additional item that can be added to the hip kit. This helps assist patients who have a limited reach in their personal hygiene needs. To end the session, you'll want to go over what you did and make sure that the patient understands everything that you did that day. You'll also want to go over and review what you'll be billing for today. Today, we did 2 units, or 2 15-minute sessions of therapeutic activities, which is direct patient contact by the provider, which is 97530. And lastly, if this equipment is not being discharged with your patient, be sure to clean each piece of equipment thoroughly. And return all items back into their bag.